Let's talk about anxiety. Just the word causes anxiety. And it may be one of the most difficult things to feel in all of psychiatry. On a personal note, I have in the past experienced and struggled with anxiety. As a person who's been both on the receiving end and on the treating end of this disorder, I do feel well positioned to talk about it. So here we go. What I do is I break down anxiety into two basic types. First is what I call a generalized anxiety, which means that you feel some degree of stress throughout the day. It could be characterized by panic or fear or worry. Second kind of anxiety are essentially panic attacks, which are different than the first group. Panic attacks are episodic, sudden, dramatic increases in anxiety that could be very difficult to cope with, often characterized by an increased heart rate, shaking, and sweating, that is also then followed by some kind of significant decrease in those symptoms. So as a psychiatrist, there are unique medications that can potentially better address one of the anxiety types versus another. For example, there are medications that are taken once a day and are more of longitudinal treaters of anxiety, meaning as you take it and the medicine builds in your body, little by little the symptoms tend to improve. There are also as needed medications that can be used only during certain moments. If you anticipate that you will have anxiety or panic during a meeting or some other kind of event, then you could time these medications to address the symptoms exactly in that moment. And both options have a list of pros and cons. So as always, the best approach is to sit down with your doctor, discuss each type of option, discuss the risks, the benefits, as well as any alternative options, and make an informed and effective decision.